Postpartum thyroiditis is a temporary condition that affects some women after giving birth or having a miscarriage, or sometimes even after undergoing an abortion. It's a malfunction in the thyroid gland, which is a small butterfly-shaped organ in your neck that controls your metabolism and your energy levels. If you want to understand how thyroid gland affects our bodies and get a detailed explanation, you can watch my video linked below. Now let's understand, why does postpartum thyroiditis happen? During pregnancy, a woman's immune system naturally adjusts, or to say precisely, it calms down a bit to prevent it from attacking the developing baby, which is technically a foreign object in the woman's body. After childbirth, the immune system rebounds, but in some cases, this reactivation triggers an autoimmune response against the thyroid gland, which is nothing but the immune system produces antibodies that attack the thyroid gland, which causes inflammation and disrupting its normal function. As a result, the thyroid gland becomes overactive, called hyperthyroidism, or underactive, called hypothyroidism, or it can swing back and forth between these states. Around 3 out of every 100 new moms experience postpartum thyroiditis, but those who have a positive family history of thyroid issues or autoimmune conditions like type 1 diabetes mellitus, rheumatoid arthritis, or lupus are particularly at higher risk. The symptoms of postpartum thyroiditis can be typically seen in phases. Phase 1 is hyperthyroidism phase. So this is usually present around 2 to 6 months. Some women may experience symptoms like nervousness, irritability, insomnia, increase in heart rate or heat intolerance, or weight loss due to overactive thyroid gland. Phase 2 is hypothyroidism phase. This is usually seen around 3 to 12 months. Women experience symptoms like fatigue, forgetfulness, weight gain, feeling cold, or dry skin due to an underactive thyroid gland. For most women, postpartum thyroiditis resolves on its own within 12 to 18 months after delivery. However, in some cases, particularly if there is an underlying autoimmune thyroid abnormality, the condition may persist or may evolve into chronic thyroid disorder requiring continuous treatment. Diagnosing postpartum thyroiditis can be a bit tricky because its symptoms often mimic those of regular post-delivery changes or stress. However, doctors can conduct blood tests to measure thyroid hormone levels like T3, T4 and TSH, and also detect the presence of specific antibodies against the thyroid gland, which indicate postpartum thyroiditis. Treatment depends on severity of symptoms. In mild cases, treatment might not be necessary and the condition resolves on its own. But for more uncomfortable symptoms, doctors might suggest you medications like beta blockers to decrease hyperthyroid symptoms, while thyroid hormone replacement therapy like levothyroxine may be needed for hypothyroid symptoms. So overall, if you're a new mom experiencing some unusual symptoms, especially related to your energy levels or mood, it's very important to discuss them with your doctor. And remember, postpartum thyroiditis is a temporary condition in most women and can be managed with proper medical care. So even when the times are tough, remember they won't last forever. Keep faith in life and its amazing surprises. Stay healthy, stay happy, and keep smiling through it all.